Hi, thanks for stopping by. I'm David Biondi. I'm Senior Director of Clinical Development for U.S. Medical Affairs in Arthur McNeil Janssen Scientific Affairs. I wanted to share some of our data with you. We took a look at tapentadol, the extended release formulation, in patients who had a history of high blood pressure who were taking concomitant blood pressure medications. Now, tapentadol is a medication that has two mechanisms of analgesic action. It's a mu-opioid receptor agonist and a norepinephrine reuptake inhibitor. Because of the norepinephrine reuptake inhibition, we received questions regarding its safety in using this in people who have hypertension. So what we did is we took a look at our phase 3 data from 3 studies. 2 studies with osteoarthritis pain and 1 study with chronic low back pain. We pulled that data together and then took a look specifically at those patients who had a history of hypertension listed in their medical history listing, as well as patients who were taking concomitant antihypertensive medications during their involvement in these clinical trials. So when we took a look at this population, we can see here that we had fairly high numbers of people. In those people who had a history of hypertension, we had 477 patients in the placebo group, 488 patients in the tapentadol ER group, and 499 patients in the oxycodone CR group. We saw similar numbers in those patients who had concomitant antihypertensive medication during their involvement in the clinical trial. Now, we were interested in looking at any effects on blood pressure or heart rate in these patients because of the NRI component of tapentadol. So if we take a look at this figure here, figure 1, this is a figure of mean heart rate over time. These clinical trials were 15 weeks in duration on study treatment, and here in this graph we have placebo in the gray bar, tapentadol ER in the red bar, and oxycodone CR, controlled release formulation, in the orange bar. And what we're taking a look at here is beats per minute, heart rate. And we can see that across the 3 treatment groups there's very little variance in their heart rate across the 15-week trial. And we can see that tapentadol runs very closely to placebo across the 15-week trial as well. The second cohort of patients here were patients who were taking concomitant antihypertensive medications during their involvement in this trial. And similarly here we see very little variance across the 15-week trial between any of the 3 treatment groups. Just to give you a little gauge here of the rate that we're looking at, 72 here, 74, and we can see that the heart rate variation was within, pretty much within 72 to 74 beats per minute all the way across throughout the 15-week trial. Now, the next thing that we took a look at was systolic blood pressure over time. And again, we took a look into 2 cohorts, those with a history of hypertension and those with concomitant hypertensive medications. Here, too, we took a look at the placebo, tapentadol ER, and oxycodone CR treatment groups. We do see some variation between the treatments. We actually see that tapentadol ER tracks with placebo across the 15-week trial. And just to give you, again, a little bit of a gauge, we're seeing some variance, but very little variance between the 3 treatment groups. Here's 130 millimeters of mercury and 135 millimeters of mercury, and we can see that that variance tends to run maybe within 2 to 3 millimeters of mercury throughout the 15-week trial. Similarly, in those patients who are taking concomitant antihypertensive medications, we see that the medication groups track very closely together, with tapentadol and placebo following very closely together. Now, the last thing that we took a look at was diastolic blood pressure. And again, we have the 2 cohorts here, the 3 treatment groups, and here too we see some variance between the treatment groups. We see tapentadol and placebo tracking fairly closely together, actually converging here toward the end of the 15-week trial. To give you the gauge in between here, we're seeing a variance between 78 and maybe 81, 82 millimeters of mercury and diastolic blood pressure. So again, very, very close between the treatment groups. And in those patients who are taking antihypertensive medications, we see the similar pattern. So with our data here, we hope to answer the question, are there any differences in the blood pressure and pulse of tapentadol compared to placebo and to oxycodone? And we've demonstrated here that there isn't any clinically relevant differences between these treatment groups, suggesting that tapentadol can be used quite safely in patients who have hypertension or are taking antihypertensive medications. So I want to thank you for stopping by, and I hope you find this information helpful.